Hello, my name is Tracy, and I'm going to talk to you about the arterial and venous blood flow from in the body. We're going to begin with the arteries, and in the heart, we're going to talk about going from the aorta up here to the brachiocephalic trunk, which could either then go up the neck here towards the common carotid or towards the arm here at the under the clavicle to the subclavian. We would then go to the axillary artery here. We would then go down the brachial artery, splitting to the radial artery, the ulnar artery, to the arterial palmar arch, and then into the digital arteries of the arm. If we're going down the body to the lower extremity, we would come down the aorta here to the common iliac artery, to the external iliac, to the femoral artery, going posteriorly to the popliteal artery, the back of the knee, which would then go to the posterior and anterior tibial arteries, down here to the the dorsal-pedal artery, the arterial plantar arch to the digital arteries. Now, if we're going to speak about the venous blood flow, we would start down here in the digital veins, going here to the dorsal venous arch, to the dorsal pedal vein here, and then we would have the greater saphenous vein, the small saphenous vein, the anterior and posterior tibial veins, the popliteal vein coming back around to the femoral vein, up the leg here to the external vein, the common iliac vein, and the inferior vena cava. If we're going from the arm, we would start at the digital veins over here, and then the palmar arch. Then we would go over here to the radial vein or the ulnar vein up into the brachial vein of the arm. We have some more superficial veins, starting with the venous network here in the hand that could split off to the cephalic vein on the thumb side, the basilic vein, and a little median vein connector here, the median cubital. Then heading up the arm as well, the brachial vein, the axillary vein, under the clavicle to the subclavian, and then that would go then into the brachiocephalic vein. If we went up towards the head, we would have the internal and external jugulars. Back down from the subclavian draining there, we go then into the superior vena cava. Thank you for watching.